Hello everyone! Welcome back. My name is Rachel Price. I'm one of the physical therapists here at Balanced Body Physical Therapy in Salt Lake City, Utah. And so you may or may not have caught my last video that we just did looking at general exercise guidelines to start to get back into exercise without injuring yourself. A lot of us has been a little bit more sedentary this past year. Unfortunately, with COVID, it's put quite a wrench in a lot of people's lives in so many different ways. And so today we are going to focus more on exercise and how to get back into being healthy after having COVID. And so many people have had varying levels of symptoms. Some people have been hospitalized. Some people had very mild symptoms. And so wherever you are on the spectrum, this is a good video for you to just start to get an idea of what to do as you move forward. So I have a few resources just down below here that you're welcome to pull up as we go. One of them I would highly recommend you open up with me is actually with the research article that has this beautiful flow chart in there, and it'll be a lot easier if you want to go through it as we go along with it. And so all of the stuff that I'm giving you today is based on CDC guidelines, it's based on reliable research from different sources, and they're all listed below for you to look through and get additional information if you want them. So let's get started. So if we're taking a look at this beautiful chart we have here, the first thing that it talks about is, did your illness require hospitalization? So if you had to go to the hospital because of your COVID symptoms, then the first thing you have to do is you need to get assessed by a healthcare provider. This could mean going to your primary care doctor, the one you go to for your regular visits, for anything that's out of the ordinary. You can go to them and they'll be able to do some screening of your heart, your lungs, blood pressure. They'll be able to give you a good idea of whether or not you're cleared for exercise. This is a very important part because you don't want to start participating in exercise if your doctor hasn't cleared you for it, especially if you were just hospitalized due to the illness. And so if you're in the hospital, talk to your doctor first, then they can provide you the information to get started, whether that's seeing a specialist for further testing, or if it's coming to possibly a physical therapist, a trainer, someone that can monitor you as you return to exercise. If that doesn't apply to you, you were not hospitalized, the next thing that's on the list is, did you have any cardiac symptoms? So were you experiencing any palpitations, so you're feeling your heartbeats? Were you experiencing any shortness of breath, any kind of pain or chest tightness, anything like that? If you answer yes to that, again, we're going back to your primary care doctor so that they can properly clear you for exercise. If that doesn't apply to you, you didn't have those symptoms, then you go on to the next one. Next one is a little bit different that you may not think about. It's actually about psychological symptoms. Some people are experiencing increased anxiety, increased depression, post-traumatic stress disorder, because this has been a very bizarre different time that we've experienced this past year. And so what we need to do is, if you're experiencing anything like that, I have some resources down below too for some online sources if you need someone to talk to, someone to reach out to. But it's also important, you can talk to your primary care doctor, or if you have a therapist that you go to, psychologist, psychiatrist, it's good to open up to them about what you're experiencing. And exercise is a great way to help with some of those symptoms. But again, you need to be cleared first by your doctor to make sure you're safe to do so. If that doesn't apply to you, next one is any enduring symptoms. So this could be anything. It could be still having some shortness of breath, having GI issues, fatigue. If you're still experiencing any symptoms, which some people get long-term symptoms from it, and we're still learning more about it. And so if you're still experiencing any, back to the doctor. Want to go to your primary care physician first, make sure that everything's cleared, and then you can continue and start your exercise program. Okay, if you don't have anything left, the very last thing, most important one at this point, is, have you been asymptomatic for at least 7 days? That means 1 whole week of no symptoms. You may have other allergy or other symptoms you normally get, but no COVID-related symptoms. And so you want to wait at least 7 days since your last symptoms before you start to go into it. Nice thing about this chart here too is it goes through every single thing and it comes down in lines to return to physical activity. Even though we return to it, there's still a whole lot of phases of how to go through activity. And this relates back to the previous video where we were talking about how to slowly get back into exercise without hurting ourselves or risking injury. And so with that, there's all these different phases, 1, 2, 3, 4, and 5, and all of them are starting off very, very light. So for example, phase 1 is basically just very light stretching, maybe light balance work, just starting to get your muscles warmed up again, starting to do stuff very light, very low intensity. You want to do each phase for at least a week is what they're recommending. So that means just start light stretching, light yoga, light balance work for about a week. If you're doing okay, no symptoms, no problems, then you can move on to phase 2. Phase 2 is when we're working on low intensity, such as walking. And so if you're already at this phase, you can skip ahead to phase 2, where you're just doing some light walking, maybe very light yoga, light biking. Again, it's very low intensity, so you're not breathing heavy, you're not sweating. It's just very light and low. At least a week of that, and you can move on to phase 3. This one is a little bit more moderate intensity, either aerobic workouts or strength training. So again, even if your goal is to weightlift, I want you to start with more light walking, light yoga first before you bump up to that. Because with this illness, we don't know a ton about it. There could be some long-standing things that we'll continue to learn as we go. And so there's problems that you could have in the heart and lungs because they're affected by COVID in a lot of people. And so if you stress them too much, you could get problems from it. So it's very important that answering yes to any of the questions I asked before, you're going to go talk to your doctor first. And so phase 3, a little bit more moderate. So now could be walking, could be jogging, could be biking. Moderate intensity is a little different for each person, and so that could mean just a little bit of increased heart rate, a little bit heavier breathing, but you can still talk, you can still say short sentences if you were chatting with someone in the gym while you're working out, still sweating a little bit, but nothing too intense. Phase 4, you're getting into a little bit even more intensity, not quite vigorous yet, a little bit more moderate to strenuous, so you're breathing a little bit heavier. Maybe you're sweating a little bit more. It's a little harder to put words out, but you can still talk some. Again, a whole week at this point. And then the last phase is where you're returning to all of your regular exercise patterns. So this is just a way to help ramp you up to get to that point that you want to be at. And so also listed below, I have this really colorful, pretty rainbow chart. And so it goes through all of what we call the Borg Scale. It's a way for you to perceive your exertion, and that's RPE stands for rate of perceived exertion. And so a lot of people, myself included, sometimes we have a hard time trying to be like, oh, is this moderate? Is this more vigorous? Should I be doing more? Is it more intense? And not everyone has access to being able to track their heart rate very easily. And so this is a way to track your intensity without looking at your heart rate specifically. And so what it is it's on a 6 to 20 scale, and each one has different things associated with it. So in the lower ranges, extremely light to light, say around 6 to 8 is essentially not really doing much. It might just be a little bit of activity throughout the day, maybe just walking around your house, doing a little bit of light cleaning, nothing that stresses your body at all. It's very light, very low intensity. When you start getting up into the 9 to 11 range, that's where you're getting a little bit of light activity, so light walking, but nothing where you're out of breath, you're not really sweating, you can hold on a full conversation while you're doing it. And that's what I love about this scale, is it talks about, okay, how is my breathing rate? How am I able to talk while I'm doing it? Am I sweating a lot? It gives you different options to try to better understand what you're feeling. And so, for example, 11 light is minimal sweating and you can talk very easily. So you're just on a nice stroll through the park, maybe talking with your mom or your grandma, and you're just on the phone or with them in person. You can hold a full conversation like we are now, and it's not strenuous for you. As you get up into a little harder, like say 13, it's getting a little bit harder. You're getting a little bit more out of breath. You can still talk, but maybe just in short sentences, not full paragraphs. And so you're sweating a little bit more. It's a little more intense. As we get into like 15, 16, now it's getting a little bit harder. So you're sweating more. It's harder to breathe. You're able to get out some words. You can say a few things here and there if someone's talking to you, but you're just doing them in short little partial sentences. And then as you get up into 17, that's very hard, very intense. You can't really talk much at this point. It's really like short bursts of sprinting. Like if you're into HIIT workouts, it's those really high intensity ones where you're just pushing yourself hard for short periods. And as you get higher, say 19 and 20, these are ones we don't necessarily want to reach for the average person. These are where you can barely breathe. It's very hard for you to continue. And so these are ones that you're at your maximum exertion, and we don't really need you to get to that point unless you're trying to train for certain events if you're a well-seasoned athlete. But for the average person, we don't need to be getting into that high of a range. The nice thing with it is they have percentages of your heart rate max listed along with it as well. And so what that means is if you have a heart rate monitor, all the cool watches they have now, they even have rings now. There's so many different things. There's chest straps. There's so many ways you can track your heart rate. Other ways is tracking your heart rate just from different areas in your body. A common one is on the inside of your wrist, just along the outside here. You can feel a little bit of that pulse. Important thing when you check your pulse is you don't want to use your thumb because your thumb has its own pulse within it that you can feel. And so if you're using your thumb, you could be getting two different pulses and it's hard to read. So you always use some other fingers. I prefer these two. And just right on the inside there of that wrist, and you can just touch very lightly, you don't have to press hard, and you should be able to feel your heart rate. You can measure it either in full minutes, so measure how many beats per minute, or you can break it up into smaller bouts. So say you measure for 30 seconds, then you times it by 2, and that's how many beats per minute you have. Same thing if you do 15 seconds. 15 times 4 is 60, so times whatever you get in those 15 seconds by 4, and that's roughly how many beats per minute you have. And so that way you can figure out what kind of range you like to work in. Some people want to do a little bit more just moderate aerobic work, and so maybe you're in that 40 to 60% range. Some people want to do the high vigorous activity, so you might be more in the 60 to 80 range. And so there's a lot of different ways that you can track this, and that's why I love this scale, because it helps you kind of put your feelings better into words and associate it with numbers or heart rates. And so these are just some general guidelines for getting back into exercise after COVID. If in doubt, if you're not sure, the best thing to do is talk with your doctor first. Go to either your primary care doctor or a specialist that you've been seeing. Talk to them about what you're experiencing, about your goals of returning to exercise, and they can help clear all the necessary systems to be able to give you the best advice on whether or not you're cleared or okay to start it. And so if you need any too, a lot of people think of personal trainers for help, but physical therapists can help you as well. And so if you're in the Salt Lake area, come on over to us or give us a call if you have any questions. If there's anything I didn't go over that you want a little more information on, please let us know, comment below, follow our other social media if you want to, and we can help best serve you. Every person is an individual, so these are just general guidelines. If you want a specific plan made towards you, then you need to come in and see one of us for an evaluation, and we can do everything you need to try to get you back to where you want to be. All right, thank you so much for joining me. Again, my name's Rachel, I'm here at Balance Body if you ever want to give me a call. I'm usually here. And stay tuned. Next week, we're going to go over general exercise guidelines for how much am I supposed to do. All right, so stay tuned. We'll see you next time.